So today I would like to present you a research on global disparity of LGBTQ plus healthcare education in Western versus Eastern medical school. Let's begin. Why is this important? Our research shown that LGBTQ plus community faces stigmatization in medical settings, and it could lead to negative healthcare outcomes. So we need to evaluate whether is the quality of medical curriculum it's good enough that we can train doctors and then we can treat them nicely. So in this research, we revealed a comprehensive evaluations of LGBTQ plus healthcare education on a global scale. And we also observed that the culture and norm could affect it, so we do subgroup analysis to compare Eastern and Western regions. And this is our methodology. We separate into two studies, which is complement study and supplementary study. I will be mentioning in details later on. We registered post-parole, and after that, we followed the PISMAR guideline. For the inclusion, we have 6 papers for complementary study and 8 papers for supplementary study. For analysis, we're using single group proportional meta-analysis with GLMM, logistic regressions by R, and subgroup analysis by regions, as mentioned, that we want to compare two regions. And here are the results. So for complementary studies, we're looking for content inclusions and clinical trainings. As you can see that there are high heterogeneity as for all parameters, the heterogeneity higher than 80%. And for content inclusion and clinical training, as you can see from the darker gray, which is referred to Eastern regions, and lighter color, which is referred to Western region, you can clearly see the difference that in Eastern area, we both lacking in terms of content inclusions and clinical trainings comparing to Western region. And to dig down, we conduct content coverage, and I have something exactly like this for 16 plots. I think it will be too much, so I'm here to summarize it for you, that there are drastic different. And for the 4 main topics that for Eastern region still lacking, and we are behind in terms of safer sex, HIV, mental health, and STDs. And we also conduct analysis on student assessment, and we observe that it is influenced by individual medical school rather than regional factors. And for supplement studies, we observe perceptions of medical students toward need of content inclusions and inclusion insufficient. And as you can see that there are an alignment of how medical students think that we feel that we need to study about this topic more and that we are still lagging in terms of LGBTQ plus education in a medical school. And this is the summary of meta-analysis. Seeing numbers can help you visualize it better, and I would like to make my conclusion here. My studies point out the clear difference between how LGBTQ plus education is taught in Western and Eastern country. And we also can observe that in clinical training, which is crucial for patient care. In both regions, we are still lagging in clinical training. And also, it is very interesting to see that medical students, just like us, we feel that LGBTQ plus education in current medical curriculum is not enough, and we also want to study more. So for future implementations, would it be better to actually incorporate more of LGBTQ plus education in our curriculums? And I know that you guys think like, oh, this is really overwhelmingly because you have physiology, hematologies, but then if we can study this more in terms of clinical trainings and can treat patients with gender minorities better, isn't it would be better that we will not neglect any patients with special needs? And that's it for my research. Thank you so much.
This is another fascinating presentation. Do you have any comments or any questions?
Your research topic is very interesting, and if I give you a minute to communicate with the deans of the medical school, what the sentence or what the message that you would like to tell the dean of the medical school about this topic?
Okay, I would begin with the fact that LGBTQ plus are being neglected, and we can observe from the high STD rates and the negative healthcare outcome that we can observe in the medical sector. And then I could point out that there is a research that obviously shown that there is a stigmatization in medical system, which lead for the patients to not feeling comfortable enough to come to the hospital and get the right treatment that they deserve. And I feel right, as a dean who cultivate and incubate the future doctor, we're supposed to implement this LGBTQ plus education in order to treat the patients in this community right, so that it would lead to a better healthcare outcomes. And as a doctor, we would not neglect any patients, just like them. So I think deans, so I would tell them, deans, please consider to implement this in our curriculum, please.
This is quite convincing. But one more thing, I would like to know more about the heterogeneity between the study, because you have the strong conclusion, but the heterogeneity is quite high actually. It's more than 80%. How do you ensure that we can combine this result and interpret as the meta-analysis?
Okay, so from what I read in the research, it says that if I square is high in terms of heterogeneity, in terms of subgroup analysis, that means it's very good. That means this is a genuine distinguish between two different studies. But from what I've wrote, it's like if I square, it's near 100, but obviously it's not close to 100. And I understand your point that high heterogeneity indicate that it could probably affect from like other factors, and the result kind of like scatter. But from my understanding, subgroup analysis, high heterogeneity indicate that it's great because you can observe the clear difference between two groups. But I could be wrong, yes.
Actually, I would like to suggest you to explore more about this idea, because your paper is quite interesting. I'm encourage you to do the publication, but when you do the publication, you should keep in mind that we have two schools about the systematic review. The first one, if you have the high heterogeneity, they don't suggest to combine the result. But the others, on the other hand, the other might ask you to do the meta-regression to explore more about the heterogeneity. But keep in mind about this one. But your result is quite interesting. Thank you.
Thank you so much. That was brilliant suggestions. ขอบคุณค่ะ